As Dr. Ashish Jha, Dean of Brown University School of Public Health, noted on Twitter this weekend, what they've done holds a lesson for us all. And Dr. Jha joins me now. Dr. Jha, I want you to take us through your thinking about why California has been able to kind of buck the trends that we are seeing envelop so much the country.
Yes, good evening, and thank you for having me on, Chris. California has really sort of applied all of the basic public health stuff we've been talking about in a pretty vigorous way. So after their July surge, in August, they put a lot of effort into ramping up testing. And one of the few states where testing is up about 35-40% since Labor Day. And they took a very kind of micro-targeted strategy. So after they looked at each county, could see that there were some big outbreaks in some counties, other counties were doing fine. And instead of statewide policies, they really targeted their efforts to individual places and try to put in policies that were that were sort of going to be effective there. And what you see is cases came down for the rest of August and September, and they have continued coming down. One of the few big states, the only big state, where cases are down now compared to Labor Day, where the rest of the country, of course, has gone way up.
This is the thing that's so maddening about the discussion here. And again, we've been around this carousel countless times, but testing leads to surveillance. Surveillance gives you an indicator of early outbreaks, which hopefully gives you the opportunity to target your mitigation efforts so that they are only targeting the places you need to target them, so that everyone else can keep doing something that looks like a facsimile of normal life. That's the whole idea.
It's an entire strategy. It's not rocket science. I think we've had this more or less figured out by March or April and have been essentially beating the same drum for 6 months. And when states do it, and New York is doing it, and New York actually is doing quite a good job. They have had a surge recently, but overall has been doing a good job. And when states do it, it works. And so there's not a mystery anymore of how do we beat this thing. We just have to implement what we know works.
Now, the big thing that is happening now is we're watching explosion in cases all through Europe. I mean, crazy numbers per capita, exceeding some of the worst numbers we saw from the US this summer. That's in the UK, it's in Spain, it's in France, it's in Italy, it's on and on. And also the weather's getting colder and people are spending more time indoors. And there's a question about, like, is that what's happening? Is this what we're seeing both here in the US and in the EU, is essentially the kind of much predicted weather churning, pushing people indoors and producing a more hospitable environment for the virus?
Yeah, so I think the weather has something to do with it, but I don't want us to overstate that, because I don't think that's the primary issue. I mean, we certainly saw a huge summer surge in the US. And when I look at Europe, you could see cases starting to rise in early to mid-August in most European countries. And they just ignored it. I mean, I thought we were in denial. A lot of European countries were in denial. And basically for 6 to 8 weeks, they just let the cases build and build and build until it got completely out of control. And now they're realizing, oh my God, we have huge problems. It strikes me that this is a lesson that countries have to keep learning over and over again, which is you don't want to be late to this virus. You want to jump ahead. So no doubt about it, winter, cold air, more time indoors matters. But I think what really matters is how aggressive you are with this virus.
One of the other issues we've been sort of getting more data on or looking into is schooling. And this is a complicated and fraught question, largely because the data is actually fairly incomplete. That said, we got some good news out of New York, which has done quite a bit of testing for those teachers and students who are going to school a few days a week, with very low positivity rates. What is your sense now that we're 4 to 8 weeks in of in-person schooling in different places in this country, what we have learned in that period of time?
It's a great question. I think we have learned something. So more and more, I think we're seeing data that younger kids, K through 5, really are not driving much in the way of infections. We're not seeing big outbreaks. Even in places where I was skeptical, like Florida and Georgia, where I thought they're gonna have a hard time keeping their schools open, they're doing okay, at least among the younger ones. So I think increasingly the evidence here is young kids, K through 5, should absolutely be back in school. Obviously, older kids tend to spread a bit more. And so we have to be a bit more careful with them. And again, if we had the kind of testing we've been talking about, I think we could open up schools across much of the country. We just don't have that. And what we need to do is we need to try some of these things and then track the data and see where it goes. But I suspect we're probably going to be able to keep more schools open than we think. And it's not just about safety of kids. Obviously, we got to keep teachers safe, staff safe. I think we can do that.
All right, Dr. Ashish Jha, who's been such an important, reliable voice for us over these last 7 or 8 months. Thank you so much.